Hi, everybody. I'm Raj Mago. I'm the editor of simpleandpractical.com, and we are honored to be here with Dr. Edward Brodkin, who's a psychiatrist at the University of Pennsylvania. He's a leading expert on autism spectrum disorders and is the director of the Autism Spectrum Program at Penn Medicine. Thank you, Dr. Brodkin, for speaking to us.
Thanks for having me.
So I wanted to focus in our interview in celebration of World Autism Awareness Day on autism spectrum disorders in adults. Mm-hmm. So how common is it when we think of autism spectrum disorders? We are frequently thinking of children. How common is it in adults?
Well, autism spectrum is with someone lifelong. So the latest CDC numbers, Centers for Disease Control, that I've seen are approximately 2.2% of adults in the United States are on the autism spectrum. So it's fairly common.
That's a lot of people, 2% of the population. Yeah.
Yes.
And how does it present in adults? Like, how would a family member know or a clinician know that this adult might have autism spectrum disorder?
Mm-hmm. Well, as the name suggests, autism spectrum, this is a very broad spectrum. And so the presentation really varies quite a lot. We speak a lot in the autism spectrum field about heterogeneity. So in other words, there are commonalities among people on the autism spectrum, but there are also a lot of differences. So the presentation is going to vary a lot. The common elements are difficulties with social communication, social interaction, forming and maintaining social relationships, and what's called a pattern of restricted, repetitive, stereotype patterns of behaviors and interests. We could talk more about what that means. Those are the sort of common defining features, but there's a huge range of variability in terms of intellectual functioning and other kinds of functioning, adaptive functioning. So, I think when symptoms are more prominent, when there are difficulties with intellectual functioning, when there are major challenges with communication, things like that, doctors will tend to notice this and pick up on it more easily, and
right.
Probably younger in the person's life. Right. I think in terms of missing the diagnosis, that happens more when the presenting symptoms are not quite so obvious. And so I think what clinicians, mental health clinicians, primary care clinicians want to look for is someone who's had a long-standing pattern of difficulties with social relatedness, forming relationships, who may have really very focused interests, who may have some repetitive motor behaviors, who may have sensory sensitivities, things like that. Are what people generally present with. And there are also a lot of co-occurring issues. So they may present with anxiety or depression, but then you may start to hear a history of some of these other issues as well.
Right. So social relatedness, certainly autism spectrum will manifest in the social realm a lot. You mentioned repeated stereotyped patterns of behavior. Like, what would be one or two examples of that, so that our listeners can understand what that means?
Sure. So it could be as simple as repetitive motor behaviors, which might mean a classic one. And I should preface this by saying not everyone on the autism spectrum has every one of these features that I'm going to be mentioning.
That's why we call it a spectrum. We're saying it's a spectrum, meaning that it can be very heterogeneous, like you said.
Right. But someone on the spectrum may have repetitive motor behaviors like rocking or spinning or doing some sort of repetitive hand flapping kind of motor behaviors. Sometimes those are mostly seen in childhood and may tend to go away in adulthood, but they may have a history of doing repetitive motor behaviors like that. There may be restricted interests in the sense like very narrow focused interests on something that takes up a lot of the person's time during the day, and that they may be most comfortable talking about that subject. And what we call a need for sameness or predictability. So many people on the spectrum really like routine and predictability, and they structure their day as much as possible exactly the same day to day. And when there are changes in those routines, they may find that very stressful. And then sensory sensitivities go under that category as well. So individuals on the spectrum may be very sensitive to light. They may wear sunglasses a lot of the time or keep the blinds drawn. They may be unusually sensitive to sounds, so that somewhat loud sounds that wouldn't bother most people so much, people on the spectrum may find very, very distressing. So those are a few examples.
Right, great. And I've had examples of, I've also had patients who can't tolerate the labels in their, they'll cut out the labels in their shirt, or they can't, the seams in the socks bother them, so they get special order socks and so on.
Yeah, that's
What
very
about
common.
What about in men and women? Are there any major differences in how it would present in a man versus in a woman?
That's become a topic of a lot of interest recently. Classically, autism spectrum is more prevalent in men than women, or males than females. So the ratio is somewhere around 4 males to 1 female.
Okay.
But there's growing research that indicating that the autism spectrum has been under-recognized in females and women. And there's a somewhat different social presentation that I would say, and again, this is a generalization, this doesn't apply to everyone on the spectrum, but as a generalization, adult women on the spectrum may present initially as more socially adept than adult men on the spectrum. And so it might be a common experience for a clinician upon first meeting a woman who's a patient that they seem fairly socially adept, so they must not be on the autism spectrum. But then if you speak with them and take a more careful history, you may hear a really striking history of social difficulties forming friendships, maintaining relationships, and a whole pattern of issues, including sensory sensitivities that really fit with being on the spectrum. So I think it's easier to miss the diagnosis in women than in men.
I see. That's important. Dr. Brodkin, like, to be honest, like mental health clinicians, you know, we are under pressure. When we see our patients, there's usually limited time. We are dealing with anxiety, depression, suicidality. Why is it important to identify that this person also has autism spectrum disorder? Like, to be honest, what difference would it make?
Well, I mean, for the same reason you might identify any condition, that people on the autism spectrum, including adults, which is what we're mostly talking about, can have a lot of difficulties. They can have a lot of suffering that they're dealing with. They can have difficulties reaching the goals that they want for themselves in life in various ways, or distress. Not everyone. I'm not saying that being on the autism spectrum means you're suffering all the time, but there are certain issues that many people on the spectrum grapple with, and if we miss it, then we're just not able to address those things.
Are these patients with autism spectrum more likely to have anxiety, depression, and similar things as a result of their social difficulties? Could that be underlying it in part?
Yes, there are higher rates of anxiety disorders and depression in adults with autism, and there are even higher rates of suicidal ideation and suicidality in individuals on the autism spectrum. So, and what I've found in my practice is that when I do diagnostic evaluations, there are many people I see who have struggled with some issues over many years, and they've received other diagnoses. They might have gotten a diagnosis of attention deficit hyperactivity disorder, or ADHD, or major depressive disorder, or anxiety disorder. And they might have been treated for those, and that treatment might have helped somewhat, but they were left feeling like we haven't really gotten to the essence of the issues here. And I'm still left with a lot of issues and a lot of difficulties in my life.
Right.
And so being able to really identify that they're on the autism spectrum can be really a relief, interestingly, for many people, for many adults. And it gives them a sense of direction. And now we know a direction to go in for the future.
Yeah. You know, you made a good point that when I was much younger, like I used to think that maybe I should not say to the patient that I think that you might have autism spectrum. And I later realized, like you said, that the patients tend to be relieved. Actually, they're not stupid. They know that there is some problem. And in a way, open acknowledgement that this could be the explanation actually tends to come as a relief. So that was a great point. Yeah.
Yeah, I found that almost universally in the patients that I see. And I think that there's a greater understanding these days of neurodiversity. And although unfortunately there probably is still a stigma with the diagnosis of autism spectrum and other mental health conditions for that matter, but I think for most people finding out, usually by the time they reach adulthood and they've grappled with these issues for many years, it usually comes as a relief to better understand what's going on.
So given that autism spectrum disorders are common, like 2% of adults, and they have so many different implications, why do you think mental health clinicians even are frequently failing to diagnose or identify in their patients that this person has autism spectrum?
Well, I think there are a number of reasons. As we discussed before, it can be subtle. It can require a really careful history taking and careful review of the developmental history to make the diagnosis. There are often co-occurring conditions that we've talked about, like anxiety or depression, that are more common in the general population and that might be noticed more easily by many clinicians. I think one of the other issues in psychiatry is that adult psychiatrists tend to focus in their training on adult onset conditions and perhaps get less training in child onset conditions like the autism spectrum and so on. And our whole diagnostic system with the DSM-5 tends to be cross-sectional in nature, in the sense that we often look at symptoms people have had in the last few weeks or the last few months, and we don't necessarily have the time to do a really detailed developmental history. And so, and the other issue is that some of the issues on the autism spectrum might appear to be something else, or there's a differential diagnosis. So if someone's having social difficulties, that could be the autism spectrum, but it could also be social anxiety disorder, it could be depression, it could be lots of other things that an adult clinician might think of. So I think there are a lot of issues that make it challenging.
So what would be some questions or some ways in which, when we are seeing our patients, adult patients, can you give us some tips about how we might identify or screen patients for possible autism spectrum?
Sure. I mean, I think the first thing is just to keep it in mind in the differential diagnosis. Keep it in the back of your mind as a clinician that more than 2% of adults in the United States are on the autism spectrum. And so, and stay aware of issues with social communication. If you have patients who seem socially isolated or unable to sort of form a social network, if they're not making much eye contact with you, if there seems to be some difficulty in social communication, even as you're with the patient.
Yeah.
And then if they have some history of sensory sensitivities that they are complaining of, or some seem to be very routinized and want to stick to a strict schedule. So just keeping the diagnostic picture in mind and considering it a possibility, I think, is really helpful. And then if you do suspect it, and if you can make some time to take a bit more of a history, including going back a little bit into the history of their childhood. And sometimes if there's an informant, like another relative or a parent, that can be especially helpful to get some of the early developmental history.
Okay. So in the developmental history, we would be asking mainly about social interactions, about possible sensory difficulties, the rigidity and sameness, like difficulty with transition, maybe to school or from school back, and so on.
Yep.
Those kinds of things.
Yes, very much so.
So if one is willing to make the effort, it's not difficult. We all general mental health clinicians should be able to do this if they are aware of it. Do you advocate? I'm sorry.
Oh, I was just going to say that to make a definitive diagnosis, it's often helpful to refer someone to a specialist who can do some more specialized assessments and take a really detailed history and so on. But to at least suspect the diagnosis or have it on the differential diagnosis, I think that any clinician should be able to do that by taking some time for a bit more of a history and keeping the diagnosis in mind.
Right. Do you advocate the use of any screening questionnaire to assist this process, like the autism questionnaire? Or
yeah, there are some screening questionnaires designed for children. I think there's less that's been developed for adults. I mean, in my practice, I use something called the social responsiveness scale, which is a 65-item assessment. There is a modest cost for using that from the publisher, but we use the social responsiveness scale and the social communication questionnaire that are available from Western psychological services.
Right. And the Baron Cohen from Cambridge has a free questionnaire, like the autism questionnaire.
Yes, yeah, that could be helpful as well.
That is free. So hopefully, this our talk today encourages clinicians to go out and try to learn more and read more about it. But then what's the next step? Like, what kind of, we can't go into treatments in detail, but can you give us some general thoughts about like what kind of treatments are available for these patients?
Mm-hmm. Going along with the idea of heterogeneity among individuals in the autism spectrum, there are a variety of different kinds of treatments that could be helpful to people depending on what issues they're grappling with. And those range from, in some cases, pharmacologic treatments, but in many cases, behavioral treatments or forms of psychotherapy or group, sometimes social groups. So it really depends on the issues that the person is presenting with. I'd say, I just wanted to put in that going along with this idea of neurodiversity that's become really prominent, the orientation is not so much to quote unquote cure people with autism, cure them of their autism, or take it away or something like that. The idea of neurodiversity is that being on the autism spectrum can be very much a part of the individual's personhood. And we don't necessarily want to take that away or cure that. That's not necessarily our goal. I think our goal is really to talk to the person, talk to the patient, our patient, and better understand their life, what their goals are, what are their causes of distress, and what's holding them back in their lives, and then target our treatments to whatever that is. So, for example, I'll give you an example. If the social communication difficulties are really holding this person back from being able to function in a job interview, let's say, and they want to get employment, but they've had difficulty doing that, having the person engage in some kind of psychotherapy or social skills group in which they can practice some of the skills that they would need for job interviewing could be really helpful. Or sometimes like I mentioned, commonly people have co-occurring anxiety or depression. So those co-occurring conditions can be helped with the usual treatments for anxiety and depression. There's no single medication that addresses all the issues of someone on the spectrum. And in fact, the core defining issues of the autism spectrum, there's really no very good evidence-based medication treatment for the core kind of social communication difficulties and things like that. So those kinds of treatments and supports are more behavioral and psychotherapeutic.
But the non-pharmacological treatments can be very helpful for these patients, right?
Yeah, very much so. Yeah, and there's a whole field of behavioral therapies for individuals on the autism spectrum, and there are professionals called board certified behavior analysts, BCBAs, who can often be very helpful in making assessments and treatment recommendations, especially for certain kinds of issues for individuals on the spectrum. And then sometimes cognitive behavioral therapy can also be quite helpful for certain issues, especially with a therapist who has some experience in working with adults on the spectrum.
Right. Thank you. So Dr. Brodkin, like you made very important points, and I hope that clinicians are like motivated to want to learn more. So can you just, before we end, like recommend like what would be the next step? What would be some resources that you think for clinicians or for patients and their families, both, like what would be places they could go to learn more about autism spectrum disorder. I believe you published a book on social relatedness earlier this year also.
Yeah, my co-author Ashley Palathra and I published a book in January called Missing Each Other: How to Cultivate Meaningful Connections. It's not a book specifically on the autism spectrum, although it was inspired in some ways by our work with adults on the autism spectrum. It's really a book for anyone, for all of us, about how to deepen our connections with each other. And but there may be some useful things in that book for adults on the spectrum. I would say there are a lot of resources these days for learning more about the autism spectrum. There's the major meeting each year is the International Society for Autism Research, and you could look at their website. The National Institute of Mental Health, their website has quite a bit of information about the autism spectrum, as does the Centers for Disease Control. There are some publishers who have really nice sets of books about neurodiversity in the autism spectrum. For example, there's a publisher called Jessica Kingsley Publishers, and they have a whole section with multiple books on neurodiversity in the autism spectrum. But in terms of like a clinical evaluation or treatment, I think trying to seek out the center in your area, wherever you live, that does see a lot of individuals on the autism spectrum and provides diagnoses and treatments is probably your best bet. And unfortunately, like you said, that can sometimes be difficult to find if you don't live near a major city. So I think one of the goals for the field is really to increase the number of services and the number of clinicians available who have some training and expertise in this area.
Thank you so much, Dr. Brodkin, again for speaking to us. And I hope that both clinicians and patients and their families will continue to seek more education and raise greater awareness about this very important condition. Thank you.
Well, yeah, thank you for inviting me, and thank you for raising the profile of this. Thank you.